Alert AF study used a computerized decision support tool in order to identify high-risk patients who were hospitalized who had a diagnosis of atrial fibrillation, to improve the number of patients who got anticoagulated during the hospitalization and in follow-up. And what they found was a clear-cut improvement in the number of patients who did get anticoagulation, and it led to improved outcomes.
The really striking thing of the study is they found this simple intervention improved the composite endpoint of mortality, stroke, embolism, or MI by 58%. So there was a 58% reduction in those endpoints at the end of follow-up at 90 days. Versus those that didn't get the reminder. And the rate of MI was dropped by 88%, the rate of stroke was dropped by 88%. So I think this is just a study that reminds us of the potential power of computerized decision support techniques, these reminders we get on our computer to remind busy practitioners that patients who have Afib that have a high stroke risk profile should be anticoagulated.
When you ask yourself why weren't more patients anticoagulated, some of it may be because of the underlying conditions for which they were hospitalized in the first place. Another factor is that the study included all patients with CHADS-VASc scores of 1 or more. And in some cases, with a score of 1, you might argue, especially during the hospitalization, whether it's mandatory. But certainly I would expect the majority of the patients had CHADS-VASc scores of at least 2 and would qualify as high risk and need to be anticoagulated.
The implications of this are that the world of digital health and electronic medicine is growing, and these sort of best practice advisory alerts are met with mixed reviews among physicians, because on one hand they tend to intrude upon our clinical practice and sort of gum up the electronic workspace, but on the other hand, when there is meaningful outcomes data, as was shown in this very nice study and other similar use cases such as prevention of deep venous thrombosis, we see that there is value to incorporating these alerts into our clinical practice and our use of electronic medical record systems.
I mean, this whole area is a very hot topic that I'm glad that lots of researchers are working on. And although I'm not aware of the ongoing studies to confirm these types of results, I'm sure they're being carried out, because when you come to the AHA, you realize how many people are invested in research and how many creative people are doing important studies. And this issue about doing better at getting patients with Afib with an elevated stroke risk profile anticoagulated is critical, and we need new ways to remind, again, busy doctors to follow the guidelines.